Okay. Hi everyone. I'm here with Christy from Skin Appeal, and we are going to do a little talk today, a little Q&A about a couple different trending topics in skincare, body contouring. We'll talk about some Botox. So let's get rolling. So introduce yourself to us.
Hello everyone, I'm Christy Hall, board certified physician assistant, owner of Skin Appeal and co-owner of Michael Christie Skincare. And Adaleta's already been talking a little bit about our services and our products, so I'm excited to be here today to answer questions.
Perfect. Thank you guys for sending in questions a couple days ago. I know I asked you. The hottest topic right now, it seems, is Botox and filler. So let's dive right into Botox. The biggest question I got was, when do you start getting Botox? At what age, what time?
Great question. I get asked that a lot, and really like preventing wrinkles from happening is key. So most girls nowadays, because it is available to you, and it was not in my lifetime, is starting in your 20s. So my kind of rule of thumb is if you have really strong muscles and you're starting to see kind of permanent lines forming when you're not making expression, then that's the time to get on it, because it's easier to prevent wrinkling, and especially when we get the really deep 11s there.
And that's what you saw on me too.
Than having to reverse that. So, you know, a lot of girls in their early 20s are even needing that, and that's just because of the sun damage and all of that that's happening as well. So, you know, it's kind of twofold, and with you guys have more things available to you, but you also have more damage coming at you as well with that. So I definitely think it's better to start when you're younger.
Yeah, I think I'm really glad that we've gotten out of this I guess discussion about should we do Botox. Now it's just what time and when. And I know that you noticed those two lines right here forming for me, because I always look angry. My friends, my fiance always ask me, you know, are you angry? Are you okay? And it was just like me scrunching up my face. So I'm really glad that I kind of got that taken care of for a little while.
Yes.
So is it a benefit, or is there anything negative with starting too early and then having to do it for so long? Because once you start, you have to keep going back, right?
You don't have to keep going back, but you'll definitely love it. And I always warn patients it's very addictive, and you are not going to want to stop it. Because it really, I don't know if you've noticed, but it makes you feel more relaxed and you look more relaxed.
Less headaches.
And
that was a big one for me. Headaches.
And you just like really love the way it feels. And so for me, like when it starts to wear off and it's like, oh my god, it's loose, it feels really strange. I like it tight, I like it firm. And so you really get used to that. So you won't really want to stop it. However, if you did, you're not going to be in worse shape. You've just anti-aged yourself for however long you've had it in effect. You've prevented wrinkling, you've prevented collagen breakdown. So you can stop it. There's no detriment to doing that if you needed to. The benefit in starting younger versus older, just like when you exercise in the gym and you build your bicep up, if you're working that muscle and making it bigger over time, you know, so if you started when you're 40 and you've been really working that muscle and we have some really big volume there, if I start shrinking that down with Botox, then we have the risk of this falling some. So the benefit in starting early is we don't really have that problem ever kicking in. You know, the brows are always going to fall with aging, and we're going to talk about that from bone loss and things like that, but I definitely think it's better to start younger.
Okay, good to know, and I hope that answers a lot of your guys' questions. So it's better to start as soon as you start seeing those lines forming, not when you already have the lines in place. So really good information there. Now, what is the difference between Botox and filler? Because sometimes people consider them one and the same. What's the difference?
Great question. I get that asked all the time. So Botox and filler, there's really no comparison. So Botox is a neurotoxin or a purified protein that goes into overactive muscles. So overactive muscles can be like between the brows here, where we're over moving this area, raising up the forehead too much, you know, smiles, clenching your teeth, you know, so girls that do that get really square jaws. When you get older, your chin becomes
I see you analyzing my face.
Yes.
You're like saying all these things and you're like, wait, do we need to check?
Making sure you don't need it. Wait, let's show back. You know, and I do all of this on myself. I mean, so I have it all done.
And she has amazing skin. When I first met her, I knew whatever she's doing, I need to do it myself, because you look amazing. Your skin is just flawless.
I practice what I preach.
Perfect.
And why wouldn't I? So Botox is completely different. It goes into muscles and it actually paralyzes and stops the movement of that muscle. Whereas a filler, the most common fillers are like Restylane, Juvederm, and there's a whole variety of differences in those. But they are hyaluronic acid, so it's a gel-like material that's natural to your body. It actually fills in things. So with that, I'm actually recreating contours on the face, like where cheekbones should be, where under eye dark circles, and so it's actually filling, not actually preventing the movement of the muscles. So very different. There's no comparison. With fillers, you can still move your face, because that's a fear of some people. It's like, oh my gosh, I'm gonna look frozen, I can't move. But if you really have good Botox, you can still look really natural, and no one knows you have it. And so that's one of the big fears.
Yeah, I think a lot of people also have a predisposition to Botox, or I guess they're more hesitant just because they've seen really bad Botox done a couple decades ago. And a lot of people, you know, if you get a Groupon or something, I would definitely not recommend that. You really need to go to an expert and someone who knows what they're doing, who's certified, who's been doing it for a long time. So that's just one thing to keep in mind. You will get good Botox if you go to someone who's really good. The other thing I wanted to mention is I actually did get the under eye filler. I wrote about this on my blog. I posted about it over to you guys on Instagram. And it is life-changing. I honestly didn't really believe it, but I was, of course, hesitant because I hate needles, and it was the tiniest needle. It really wasn't an issue at all, and it really made a big difference. I showed you guys different photos of the before and after, and you can even see from my feed on Instagram the difference of how my eyes look and how much deeper this area was before I got the filler, so it does make a big difference. And I know a lot of my friends are going to be coming to see Christy to get that done too, since I really pitched for it and I really believe in it. So I think it's awesome. And the only other thing I'll mention is, like Christy said, it is hyaluronic acid, which is natural to your body. So it's also another way to motivate you to do it, because you're not putting any weird chemical into your body. It's something that's already natural.
Yes, so fillers are, I call them your best friend as you age, because really what happens as you age is you're losing the volume underneath the skin. So you're losing fat pads underneath the eyes, you're losing your cheekbones, you're losing your jawline, and so that just makes everything fall down and gives us a really tired, kind of a saggy look as we get older. So again, preventing that before it happens at a younger age is great. I think, I don't know how old you are, but I started mine when I was in like 31, and it made
I'm 27,
made a tremendous difference. So yeah, I mean, if I would have known that I could have done it earlier, I would have been on that as well. But really, like when I first started fillers when I was around 30, 31, these were brand new techniques. You know, so I love it. And under eyes are my favorite area to do on people, and really a lot of practitioners aren't very experienced in that area, so that's definitely an area you want to go to someone that knows what they're doing.
Very sensitive area.
But the nice thing is it lasts a long time. It lasts 2 years there.
Yeah, so I was going to ask the difference between Botox and filler, because there's obviously a pretty big difference in terms of how long you can go without getting a refill.
Right, so Botox, like every 3 to 4 months for most people, although over time it will start to last longer and longer. I've been doing my Botox for 14 years, and really at 10 months I can barely make mine. I think I forgot how. And so it really can last a long time with that. Under eye filler, 2+ years. Even if you didn't do it again within 2 years. I just had a patient, she's actually on my website before and afters, and I haven't seen her in 3 years. We did a major transformation on her, and she's
I've seen those photos.
She still looked amazing. And I mean, I just did a couple syringes to maintain that. However, you're still aging every year, so I do recommend that you come in for a little maintenance at least once a year. Even if it's like 1 syringe of filler, or even Botox once or twice a year, you're still anti-aging in that way, and definitely our skincare is going to kick in with that as well.
Okay, perfect. So I'm going to ask you a little bit more about your skincare brand, which is everywhere around us, Michael Christy. What inspired you to start the brand? Tell us about it. How long has it been in motion? Tell us a little bit about the system.
Yeah, so Michael Christy is here, and I am Christy of Michael Christy. Michael is my business partner who actually formulates the products. So these aren't private label products. We actually make the formulas and put a lot of thought into them because we want products that really work with it. Michael was actually my patient for, oh gosh, probably going on 14 years now.
Okay.
And at my last practice, we had a really great relationship. He would send his patients to me, or he called them clients, and I would do like things that he couldn't do, like fillers and lasers for the redness and things like that. And I was just always like in awe of how beautiful their skin was. So when I went on my own, he approached me and we kind of decided to create a line together. Knowing how I like results, I'm a very results-driven person. I want you to be like, wow, my skin is amazing, and that's what. And again, with everything that I do, that's what I want with it. So we kind of took his some of his old formulas and then kind of amped them up into a more of a pharmaceutical grade, so that we see more dramatic results with them, and they work really, really well. So the concept is, I wanted a skincare line that is not only effective, but all natural, no chemicals, vegan, and we've achieved that really nicely.
Amazing. Cool. So I've been using the Michael Christy skincare brand for a couple months now. You guys have again seen this all over my blog, all over my Instagram. My skin is doing a lot better. It's much more stable and balanced. And the one thing that really surprised me when I met you is the fact that you gave me this knowledge that you don't necessarily need every single product. You don't need 10, 15 products a day. A lot of skincare brands right now are telling you, you know, you need to have all of these products. You need to have an oil. You have to do this. You have to do this. And it's like, at that point, you just get kind of overwhelmed. So I think that the fact that she told me you shouldn't have to use every single product every single day is amazing. There are obviously key products that you have to use every single day because of cell turnover. But a moisturizer, for example, you don't need to use that every single day. Your skin should get to a point where it can balance its own moisture. So that was interesting to me. And then the other thing that you mentioned was that people are using skincare for skins that they don't have. So if you were a combination back in high school and now you're actually dry and you're still using combination, that may not be the best solution for you. So right off the bat, when I met her and we had our consultation, it was just a lot of information that no one has actually ever told me. And that's the one thing I really love about you, is that you educate, because people are buying and spending money on products that they don't actually need, that are actually not doing anything for their skin. So the difference here is that this skin line is really amazing, and it is results driven, like she said, and it's definitely worked for me. My skin doesn't break out as often. It's much more, it has a lot of elasticity. It's much more bright. I mean, it's been a night and day transformation for me. And you guys know that it's hard for me to stick to one skincare brand because I always like to try everything and try the newest oil and try the newest serum. But it's just been something that I haven't changed my skincare routine in like 3-4 months now. So it's been super beneficial for me.
And that's a really great point. So you don't really have to change your skincare as long as you cover the basics. You can add in other things, like if you want to try other things, as long as you're hitting those 3 core steps that I taught you about.
Yep.
You can throw in other things and try them out, but you always need the 3 minimums. So the 3 minimums are sun protection with zinc oxide every day, face, neck, chest, forearms, and hands, because that's where we age the most. We need cell turnover or exfoliation. That is not a physical exfoliation. That's a product like our retinaldehyde or Vital A serum that's actually making the skin function better and turning over cells faster. And then we need collagen stimulation. So collagen is the name of the game in keeping the wrinkles away, keeping your pores small, keeping the skin really firm and smooth, like it did when you were a child. So the purpose of Michael Christy is to make your skin function at its optimum, and that's what we do in that. So you know, as long as you're hitting those 3 basic steps, you can again add in other things. Of course, we love Michael Christy and I want you to stick with that, but you know, feel free to throw in some other things if you want to try it, but there's really no necessary need to.
Right. Yeah, there's no need to add anything additional. That's what I really loved. So it's definitely given me the results I've needed, and I think you guys can definitely be the testament of, you know, we have a little audience behind us as well. They've definitely seen my skin transform over the past couple of months, and so have my friends. And between the filler, a little Botox, we kind of did a little mini baby session, and all the skincare, my skin is very different. And I know you guys notice that when I do my selfies and my Instagram stories. You guys can totally tell, and I've been getting so many compliments about how radiant I look. So I really do think that it is a testament to Michael Christy skincare. So yeah. Anything else about the skincare line that is good to mention?
Yeah, I mean, we actually push your skin to the limits. So sometimes when you get started on our skincare products, you actually may have a detox period. And during that detox, we may go through a little flaky, peely skin. We may have a little excess breakout. We always encourage you to call us so we can help you through that process. But that's actually good things. It means it's getting rid of all the toxins, all the dead skin cells, getting rid of all of that acne that's lingering underneath the skin. And really, it's about 2 to 3 weeks. And once you're through it, you don't have those problems anymore. But it's hard for some people to get through it. I think you actually experienced a little bit of that as well. But once you get to the other side, it's like amazing. Your skin is so different, and the girls in the room are saying the same thing. I mean, it's like your skin, it just glows and it's radiant and it's so healthy and it just feels amazing.
And what about the price range?
Like, the price range is very reasonable. And you know, I'm coming from the big medical skincare lines, so our price point is very much significantly less than those. I would say about the third the cost of the medical skincare lines. And I do consider ours, you know, pharmaceutical grade products. Our serums are actually made at an FDA approved lab. You know, so we make sure that the products are actually penetrating the skin and not just sitting on the surface of the skin. We make sure that we get the purest, highest quality ingredients, and you know, we also want them to be sustainable and eco-friendly, and you know, so all of those are really important things to the Michael Christy brand.
Yeah. What are a couple good products to start with? So if someone doesn't use really any skincare, maybe they wash their face, they may moisturize, maybe they use a toner, what's the best way to start with Michael Christy?
Great question. So our Adaleta Serum is always #1. So this is the one that does the cell turnover and the exfoliation and the collagen stimulation. So this product everyone needs, and then we build off of that. So the difference in this vitamin A, it's a retinaldehyde versus retinol or retinoids, which are prescription. The benefit of that, this converts to retinoic acid in the skin, just like a prescription retinoid. However, when prescriptions are put on the skin, they're very irritating. So the retinaldehyde is much more gentle. You don't go through that like dry, flaky, irritated period ever with that. And then I also, I mean, it's hard to say like what is the second best product. It's either going to be our Peptide Serum, which most people fall in love with because you get that kind of, I call it Photoshop skin. It looks like you have makeup on without makeup. Or I'm kind of tied between that and the swipes. And I don't know, what do you think? I mean, because I think both of those are super addictive products, because the swipes just brighten your skin so much. And they're a little fiery in the beginning.
They are. You have to get used to them.
But it takes about 2, and that just shows you, like, to me, if your skin is having that like little burning sensation, it just shows that your skin's not super healthy. And
so
then
these are the swipes
after using them for about 2 weeks, then you don't have that sensation anymore,
used to
because your skin is so much more robust and so much healthier with that. But I think it's a tie between definitely Adaleta for everyone, and then a tie between that and the Peptide Serum. Agreed?
Yeah, and I really like the swipes. These, I think some people call them like pads or cotton pads, whatever, but these are amazing. They definitely do sting in the beginning. I remember texting you and I said, should it feel like my face is a little bit, you know, a little bit irritated? And it's just because you're getting rid of that dead skin on the surface, and then over time you just get used to it. But the difference between a day of using those and not is drastic. You wake up much smoother, much more Photoshop, like you said. I mean, there's a very big difference when you use those swipes. So that's probably my favorite. And if you can use it all over your body too.
One
like
swipe
your
will go
arms, like you can get all the way down to your chest, because we usually don't give a lot of love to the back of our hands and then also the chest. So I just use that one all over because it's so drenched in the moisture.
Very nice.
I love it. I wanted to also talk, so this is a very, very hot topic right now. Again, another one that you guys have seen me talk about for the past couple months, and it is hot, hot, hot. It is body contouring. We keep hearing about CoolSculpting. It's CoolSculpting this, CoolSculpting that, and I feel like a lot of people are jumping into it before they actually know the full options and all the details of it. And that was also me. I definitely just jumped into it thinking, you know, let's burn away the stubborn fat. I didn't look at any of the research for anything else. So what are you guys doing here that is considered body contouring? And I also want to get your opinion as well on what's more effective. Is it CoolSculpting, which everyone is hearing about right now, or is it something else?
Great questions. Yes, body contouring is fun. I've done it, love it. But just like with all marketing, CoolSculpting has done a really fantastic job getting their name known on the market. Just like all the big beauty companies of like moisturize, 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 and we know that that's not the key to beautiful skin. The key is to get your skin functioning more optimal. So my goal in life is to re-educate people on all of these myths with that. So CoolSculpting works by freezing the fat cells to a point where they die. We use a different technology. We use radio frequency and ultrasound technology to heat the cells to death. So both methods work. Fat cells are actually pretty delicate, and you can kill them pretty easily, thank goodness, with that. And so, you know, whether you choose CoolSculpting or we use something called Vanquish Me in combination with Exilus Ultra, we do a dual combination to get the best results with that. Whether you choose either one, the fat cell death that you get is a permanent fix for that. And once, you know, you're born with the number of fat cells that you have, but a fat cell can be really tiny or it can be really big. You know, so if you have one fat cell, it can grow if you feed it with that. So the difference is CoolSculpting actually sucks you into a little vacuum, so it does more bulging. It feels like it's like sucking you into the machine, which is a little intense. To me, when I used to do CoolSculpting, and I always like to do treatments that give you the best results for the best price point. And I just never loved the results of the CoolSculpting. You have to do kind of a stacking where you do like a large tip, small tips, and they kind of like angle it across your whole abdomen. It hurts afterwards. It's so painful. It's like, oh my gosh. And it's really expensive to do it that way. I mean, because you're paying for each little tip. So I wanted a device that, it treats a larger area. So the Vanquish Me actually wraps around, it covers the entire waist and wraps around the waist. And we do a treatment called Cellulite where we flip you over and do the back of you, so then we're shrink wrapping your entire waist. So we're not just doing bulges, we're actually shrinking the waist down, which is really nice with that. And the other thing with CoolSculpting with bulges is you can sometimes get areas in between the tips that get a little dip in them. And so this is nice because it's a nice uniform area. We add the Exilus Ultra to it, which preheats the fat so that when we put you under Vanquish, we get more fat reduction. So again, bang for your buck, let's get more results. And then the Exilus Ultra also tightens the skin. So it's actually shrink wrapping and lifting at the same time. So that helps with cellulite, helps with loose skin. So again, you see way more result with it.
Yeah, it's a full treatment.
You do have to do 4 treatments of the Vanquish Me at 1 week intervals, whereas CoolSculpting you typically do 2 or 3, so it might be a little bit more. But I think the price point on
it's night and day
on our silhouette, which is like all the way around, and some people, I mean, average waistline loss is 3 inches in 4 weeks, and that's like awesome. Who doesn't love that? I think the price point's at least a third the price.
It's a third of the cost
if you did all of that.
I mean, the CoolSculpting price for me, I did 2 rounds, and it was the waist area, so it's my stomach, my hips, and we kind of did the back, but that's what I really didn't like. It was specific areas, so when I started shrinking in the front, everything in the back was not shrinking. So it kind of gives you this not so perfect element, I guess, to your body. So then it was like, well, we have to do the back too, and that's going to cost way more because you got to do 2 rounds of that as well. So you just keep adding these pieces, and it was really painful. I mean, now knowing I'm going through both treatments, CoolSculpting was so painful because as soon as the device is taken off, so your skin gets used to the freezing, but when you take it off, it is just the most painful thing because all the blood is rushing to that part of your body, and it just hurts so much, and then you have to massage the area, and it's just not pleasant. Whereas with the treatment here, it's just really heating up the cells. You get a little hot, you're a little sweaty, but it's really not uncomfortable at all, and the massage is night and day. Again, I mean, it doesn't feel terrible. It's actually like nice and soothing because you're breaking apart the fat. So I am a huge advocate for the treatment you have here, and I like that you kind of targeted all 3 in one. It's not just fat reduction, it's you're preheating the skin, and then she's also concerned about the elasticity of your skin, so you're not just stretched out and you have a ton of stretch marks. We're trying to tighten the skin back together. So there's a lot of benefit to this treatment. And again, I know a lot of you guys, when you found out how much my CoolSculpting was, jaws were dropping. I mean, if we're talking about a third of the cost, CoolSculpting was almost $9,000, and this treatment is going to be somewhere in the $3,000 range, depending on where your area of treatment is, of course. You can always do.
Yeah, you can.
I was going to ask you, like, what are the specific ones that we can do for the body? Because obviously it's the hip and the stomach.
I mean, you can do all kinds of areas. You know, you can do lower abdomen, upper abdomen. You know, for most people, we just kind of target the middle, because that's where most of us.
That's where the fat goes.
And we have a way of like crunching it together, so we can get more fat underneath the thing. So we'll like wrap you and push it all
it's
together.
not a cute look. It's not a cute look when I'm laying down and it's all smushed. I'm like, oh, don't look down.
But we'll do like love handles on the back. You can do your upper back fat. You can, you know, we can do like the bra fat. I don't love doing the arms. I think that's an area that people aren't super excited about. There's better treatments for arms than that. Thighs are a big area. You know, so anywhere that you have some fat that you want to reduce, we have something to do with it. I mean, we also have injections for fat reduction and things like that.
Yeah, of course. I think the one takeaway I really have with body contouring, it could be, you know, that we've gotten a lot lazier in the US and that, you know, we don't want to work out, but this really isn't the case, because you guys already know I'm training for a marathon and I still have love handles. I still have fat on the inside of my thighs that I want to get rid of. That it doesn't matter how much you work out, you will not get rid of that fat, because it's that stubborn fat that's just going to stick to your body because you have fat cells there. And it could be genetic, it could be whatever, but it's really that stubborn area that you just can't seem to get rid of. And I don't know if anybody knows exercises that get rid of love handles, I mean, besides some basic ones, but this is really a treatment that if that is something that you are, you know, self-conscious about or you don't care for, I think it's a really important thing to consider it, you know, because it's just going to be a better look overall, and I already feel more confident, and my results from your treatment are significantly better than what I did with CoolSculpting, and I can't wait to share the photos of before and after, because it's just so different. And
how many treatments have you had?
I've already had 3, so I have one more on Wednesday, and it's just
I always feel like after 2 you can really tell a big difference.
Yeah,
like
I can tell.
For me, even after 1, you just feel tighter.
Like you feel tighter, and like the skin is shaping in a better way, rather than like the sucking in and then you're kind of formulating it. So it's been a really good process. So I'm excited to finish that last treatment and then have my full results so I can show the before and afters.
Also, there's a lot of science behind the radio frequency vanquish as well. It proves on the scientific studies that it kills more fat cells than CoolSculpting and all the other laser devices on the market. Plus, it's the largest area of all of them, meaning it covers your entire abdomen and your waistline. So, again, like I like bang for your buck. Like I'm not going to sell something to my patients that I don't love, and that's why, you know, when I do a lot of research into when I buy a machine,
it seems like it would be more natural to burn the fat cells too than freeze them, because that's how when you're working out your body, it just seems like it makes more sense to me. So I just wish I'd done the research and just come to you right in the beginning.
Well, you know, it's like the difference in the marketing. I mean, CoolSculpting's done a fantastic job marketing, and again, you know, doing some research and really kind of digging in deep is what you need to do with all aspects of your health.
Yeah. So do we want to take some questions maybe now from the Instagram side?
Great question. Droopy eyelids is, you can do a little bit of brow elevation with Botox. It can give you a little bit of an instant fix, but really the issue is the bone loss underneath of the temple area and the brow bone area that makes it fall down. So recreating the volume there and lifting that back up with fillers like Restylane or Sculptra is going to give you a much more long-term change. With that, if you have very significant eyelid droop, I mean, the easiest thing is just to do a surgical blepharoplasty. It's an easy surgery, and sometimes it's just worth having 5 days of downtime to just be done. But yeah, so Botox can do some change, but not a very significant change.
Yeah.
Great question. So I love dry brushing the body. So again, it's the same concepts as your facial skin. The skin on the body doesn't absorb things quite as well as the face because there's less pores, less oil glands on the body. So you still need the same basic concepts of the sun protection to prevent the brown spots and the red spots and the collagen breakdown. So zinc oxide, SPF every day, especially on forearms and hands that age the most. We do need to do cell turnover, exfoliation. So the easiest way of doing that, plus it helps your lymphatics, is doing dry brushing before you get in the shower. And then any cream-based moisturizer is going to be the best for you. We have several in our line, the Christy Vital C Body Serum, and then our Lemon Verbena moisturizer are very nice. So again, you know, the problem with buying less expensive moisturizers, and I know it's like your body, it's a large area to cover, but the issue is the chemicals that they put in it. It really causes a lot of endocrine disruption, so that's a lot of reason why we have a lot of thyroid issues and hormone issues nowadays, is because we're just slathering our body in these chemicals that aren't great for you.
One thing I wanted to bring up, because I've also been an advocate for this, is the Bbl treatment. So in Arizona, obviously, we have a lot of sun a lot of the year, basically, and even in places on the West Coast and anywhere that you are, even if you don't have sunshine, you have the overcast, which also gives you that sun damage. So what is the main benefit of the Bbl treatment? And kind of explain it, because I've been really a huge advocate for this. I love it. I mean, the difference is drastic, because you know, I had the sunspots under my eyes, and one treatment cleared it all up. So tell us about this sun damage reversal. So
BBL is a photofacial, so it's the next generation of IPL. You know, we had IPL back in the late 90s, and so BBL came out probably like 8 to 10 years ago, and the difference is the way they deliver the light to the skin. So BBL or IPL is not a laser, it's actually a spectrum of light. So the benefit of having a spectrum of light is we can have multiple targets, meaning we can treat the brown spots on the skin, we can treat collagen stimulation, we can treat red broken blood vessels, all in one kind of treatment session, which is really nice. So yes, as we age, I always find like around age 30 is when your bad things that you did when you were a teenager show up on the skin. You're like
sleeping with your makeup on,
like
sunbathing,
all those brown spots from tanning show up, and all the broken blood vessels start around the nose, the pores get larger. You know, so BBL is a nice way with no downtime to really do some treatment on those things. And yeah, with one treatment you can see most of your brown spots disappear. Redness can be a little bit more stubborn, so if you have a lot of redness or rosacea, you might need 2 or 3 treatments with it. But it's nice because you're not peeling, you're not scabbing, there's no downtime, it's easy. I wouldn't say it's the most pleasant, it's really annoying, but we can get through it. And I personally do it every 3 to 4 months. Stanford University did a study on it and proved on biopsy that if you do it at least once a year, it keeps your skin from aging, because it keeps the genes of youth turned on. So I do mine every 3 to 4 months because I want to keep my skin as young as I can. But you know, even just doing and investing in it once a year is amazing for your skin.
Definitely. Okay, I just wanted to make sure we talked about that, because it's done amazing things, and a lot of people say that you can't reverse sun damage. Turns out you can. Puberty. Puberty.
Well, I always say, like, anyone over age 10, your skin is changing. It's becoming massively dysfunctional. And in our teenage years, we see that with acne, oily skin, and then it just gets worse every decade after that. So you really start to notice it in your 30s. So I would at least start in your 20s, because you can prevent collagen loss, you can prevent the aging on the skin, you can prevent skin cancers. I mean, so you can really nurture the skin and keep it healthy. You know, and for me, like, I started doing all this when I was 31, and now I'm almost 46. But
no one can tell.
I look better now than I did then, because my skin is so much healthier. Plus, I've done a lot of fillers, and I look better. But yeah, so I would say, you know, the younger you are, and you can just start really simple. I mean, just your sunblock and your Vital A serum is really, if you just want to kind of go on the least expensive route, you can start with less products and then add on more later as you get older. But you know, that covers all your basic needs for the skin. Vanquish unfortunately does not work on fat in the chin area. CoolSculpting does an okay job there, but the best is Kybella, because we're actually injecting deoxycholic acid into that area. Deoxycholic acid is what Kybella is made of. It's what your liver produces when you eat fat to break it down in your diet, so why not just take that and inject it right in there? It would be hard to do an entire abdomen with that, because it would take a lot of product, but you know, anywhere you have like little fat bulges, like here, broad Jaw fat's a common area.
Yeah, like that.
You know, you can really taper that jawline nicely. So you're going to get way more effect from Kybella than doing like CoolSculpting or any of the other fat reduction treatments, and it's permanent. I did it on me. I didn't have a lot, but it made such a dramatic change on my profile because I always had that little bulge that I hated. So Kybella.
We're gonna have to talk about this later.
Kybella, right? I know.
Like, I'm getting there. I'm like,
I know. So Kybella is definitely the best thing to do for that area.
So one thing that I feel like a lot of people ask is, so Kybella is one thing, reducing that, you know, fat under your chin, but what about with body contouring? If you kill those fat cells, are they going somewhere else? Or with Kybella, like if you burn that fat off, is it gonna end up like in another part of your body, or is it just permanent?
It's permanent in that area. However, we're not getting every fat cell. Okay. So, you know, if there's some fat cells there and you gain weight, it will eventually come back. Okay. However, it goes to the easier areas first. So if you you know, haven't treated like your breasts, which are a lot of fat, or like your upper abdomen or your thighs, and you gain 50 pounds, then you're going to notice it in those areas before the areas that have been treated. So the key is to not gain a lot of weight.
You have to continue being active and having a healthy lifestyle. You can't just burn off the fat and then just go eat at McDonald's every day.
Right. So I mean, I would say that you probably wouldn't notice it within like 10 to 15 pounds of weight in any significant area. You know, for me, like I did you know, Vanquish on my abdomen, and I actually gained about 10 pounds. And what I felt was, you know, like it went to other areas, but it was much more of a uniform look that I still liked it better than having a big belly. Right. And my clothes still fit better. So I mean, even though I did feel bigger in some other areas, it was not that big of a deal. Yeah, so back knee is definitely a little bit more challenging because it's hard to reach your back, but definitely, like, I think the easiest thing to do is get a brush and, you know, when you're washing yourself in the shower, is to really cleanse the back and exfoliate that area very nicely. But, you know, with acne, the major thing is not just the skincare, it's the internal changes. So acne is an inflammatory skin condition, so our diet plays a big role in that. So dairy products tend to be the biggest cause of oil overproduction, stimulating our you know, our hormones in the body, our insulin-like growth factors, can't talk, and our testosterone in our body. So really changing the diet makes the biggest role, especially for back acne. But definitely getting a scrub brush, and then you can put your, you know, use your swipe back there, and that makes a big difference.
Oh, one other thing, is there a plan to create some kind of product that is collagen stimulating for the rest of your body? So we deal with cellulite and whatever it's called, butt light. I don't know. I mean, there's a lot of cellulite back there. So is there something that
we can use? Christy line?
Yeah.
Yes. Well, we already have some of that, and we've already actually formulated a cellulite cream. We just haven't launched it yet either. Yes.
That's exciting.
But our BioSculpt neck firming cream is amazing. And so that firms the skin. I use it on my arms. I use it everywhere. It actually lifts and tightens, and it does an amazing job. You just massage it in really nicely, like twice a day. So I think it works great, like on the crepey skin here. We also have our Vitamin C body serum, which is nice. You know, vitamin C stimulates collagen, but it's also moisturizing. So yes, all of those, dry brushing. I mean, that helps. I'm going to be rubbing that all on my thighs later. Cellulite is not the easiest thing to see a change in. So cellulite is either not always cellulite. Sometimes as you get older, it's just loose skin that's kind of folding on itself. And so you have to really be evaluated to see what's going to make the biggest difference in that. So sometimes, you know, fat reducing it's not the answer with that, because it actually makes it look worse with droopier skin. So sometimes it's skin tightening. I also like to inject Sculptra into this little divots, and that's the fastest way to make them go away.
For how long?
Years.
Oh, okay. Yeah. We'll be talking about that later too.
So we smooth that out.
I'm like, I need everything.
It's good for everyone. Our products are very safe, so even children can use them. But yes, in your teenage years, we definitely need to start treating the skin to prevent the overproduction of the oil, prevent the acne. And if you can get your teenager to do skincare when they're young, then that's going to just be part of their lifestyle. So they're always going to look great and have beautiful skin as they get older. Prevent the acne scarring on the skin with it. So, you know, using the swipes and the vitamin A at a minimum, but also our refreshing botanical wash to kind of have that alpha hydroxy acid that we were talking about to decrease the oil production is great as well.
Yeah.
And then until you're 110, so you stop.
Yeah, I think we have the benefit now that the generation that's younger than me, so I'm going to say it's the Gen Z, they kind of know about skincare already, yes. And it's something that they've already started using when they are around 15, and they know that sunscreen is a thing. Tanning beds were the worst thing that happened in my generation. So I feel like we've definitely gotten more information, so people are starting younger, that way that they can do the preventative before they have any wrinkles, before yes. they have issues with their skin. So absolutely. We do have the benefit of the younger audience is definitely more informed, which is a huge benefit to skincare in general.
Yes.
Yes, my Rejuvenating Swipes. So these are the ones that I talked about earlier. They are cotton pads that are basically saturated in the product. These are my absolute favorite because I see instant results, and I really like instant. I feel like a lot of people do, but when you can tell a noticeable difference in your skin the next day after you use these at night or in the morning, right? You can use them twice a day.
I would say once a day is good. Okay. Twice a day is a little much.
I use them at night, and I just rub this all over my pretty much everywhere. I do it all down the neck, pretty much everywhere from like the boobs up. You kind of just get it all in, but this is definitely my favorite Michael Christy product.
Yeah, and we have our core kit, so it comes with all the basics. You get your cleanser, you get your biopeptide lotion, which is the moisturizer. The biopeptide serum, besides the swipes, those are our two, like, tend to be people's most favorite. You get the Vitamin A serum, you get the swipes, you get everything you need in that core kit, so it kind of gives you all your basics, and it lasts about at least 4 months. I mean,
and it's travel friendly, so I've been taking it on all my trips with me because you have everything that you need. And Aaron really likes those too. He's been stealing my skincare. I'm like, where's the serum?
I know, you know, guys, get into this.
I've definitely made him get into this. He's definitely interested in skincare. He's actually one of the reasons I got so into skincare, and I just like the science behind it, because it's really, if you use the right products, you're going to end up with really nice skin.
Yes,
I mean,
definitely.
It's true.
So you can visit us on michaelchristy.com or myskinappeal.com if you want to learn any more information about what I do, or feel free to call or email me or Adaleta.
Yes, and I'll do a couple Instagram stories later today, and I'll tag their handle. I'll have a swipe up for their website so you guys can go check it out, read more about the science behind it. But Christy is an amazing woman. Like I've told you guys already, she just blew my world with skincare. I thought I was a skincare expert until I met her, and she schooled me on a lot of things, a lot of myths that we have out there about skincare, which is just really good marketing over the past couple decades. So I think it's really important to be very aware and understand that certain things have just been told to us for a while. They may not necessarily be true. So that's really why I've been looking to you for all the advice, everything.
I love doing it. I mean, it's fun for me. It's my passion, and I absolutely love it. And I love the artistic nature of, you know, the fillers and Botox and those kind of things.
The other thing too that I know I've talked to one of Christy's team members is, she will never recommend something to you that you don't actually need. So when you go to certain people and you get a consultation, they're going to try to sell you every service that they have because they can, because you may be naive. Whereas with Christy, she told me 2 things that she thought I needed, which was the sun damage reversal and then the Botox up here. We talked about the under eye filler, and it was something that I wanted to do personally, but she didn't push any of that on me. It was more of, what do you think your issues are? These are the 2 things that I think you can focus on. And so that was something also very endearing and awesome, that as a professional, she's not trying to sell us all of these services just because she can. So I definitely trust you, and I want everybody in Tucson, Phoenix, Arizona area to come to Christy, get a consultation. It's totally free. She'll tell you her recommendation. Just because you get a consultation doesn't mean you have to do all of these things. It's just going to be more informing you about the sun damage on your skin and just kind of what you want to do long term.
Thank you.
So we'll talk to you guys later, and I'll have more information about Christy and Skin Appeal later. Bye.